Awesome. Well, man, it's so good to have you here, Jared Walker. Anyway, I'm Michael Mann, the host of Planetary Health First, Mars Next. And really, it would be great before we get going on, just quick intro about you and love that you're here. So important.
Yeah, no, thanks for having me. My name is Jared Walker. I'm the founder of an organization called $4. We're a nonprofit. We help people eliminate medical debt.
Awesome. Well, obviously, you are no stranger to healthcare. You've been doing this. We had a great conversation before, getting you on our show. It's almost been how many years since you started this?
So officially, I started $4 in 2015, but it was something called $4 Portland. I grew up in Portland, Oregon, and I started a crowdfunding platform to help people pay medical bills, and that's kind of how it all got started.
And so when you now are almost 10 years in, this is evolution has certainly evolved. Tell me what you thought when you started this versus where you are now today.
Yeah, completely different. Not where I thought it would land, but I'm happy. The pivots we've made along the way. I started $4 Portland originally, like I said, a crowdfunding platform to help people pay medical bills. I watched my own family go through a medical emergency. So my wife and I were sitting at home. She got a phone call. Her aunt had passed away from cancer. And then a couple minutes later, I got a phone call and my cousin had gone into labor, 7 weeks premature. Baby needed a heart surgery to live. And kind of same day, same hour, we were both hit with these medical emergencies in our family. And I remember the conversation of, how are we going to pay for it? What are we going to do? And I was really frustrated that was even the thing that we were talking about, rather than, people's health, or it was just kind of my first run in with the US healthcare system, I guess, of just realizing when you have a medical emergency, a lot of times you have a financial emergency, and that frustrated me. So I started helping people pay medical bills by, doing really grassroots organizing. Portland's an interesting city, so it was all around coffee shops, breweries, music venues, small dollar donations. Every month we'd pool the money together and pay medical bills for somebody. So I did that for years, from 2015 to about 2019. And I met an attorney. His name's Eli. He's now on our staff. And he told me about something called hospital charity care, hospital financial assistance. And he said, "Oh, have you ever leveraged this to help people with their medical bills?" And I'd never heard of it. So I said, "No, what are you talking about?" He starts telling me, nonprofit hospitals, all of these hospitals in America are nonprofits. And in order for them to keep that tax exempt status, they have to have charity care, financial assistance, community benefit, whatever you want to call it. And a part of that is that they have to write off or waive completely the medical bills if you are within a certain income range, defined by the hospital. So I kind of thought it was too good to be true. Didn't put a whole lot of thought into it. We ended up meeting again. He reminded me, hey, you should look into this. And I helped a couple patients fill out the paperwork, dove into some policies, and it worked. So we kind of pivoted there, but I can go in more detail.
Yeah, I think we should. And I think really about the impact you've had. You shared our previous conversation about $75 million in charity care debt. And then was it 14 billion of unrealized not-for-profit across the U.S. healthcare system that's eligible when you aggregate it? Is that annualized 14 billion?
Yeah, so every year hospitals miss about $14 billion of charity care that should be going out to low and middle income patients.
Wow. So basically I would imagine there would be no medical bankruptcies, or I don't know what the 1-to-1 ratio or correlation, but if you utilize that, I bet you could get down 15% would be versus the 80% of medical bankruptcies due to that. I don't know. Love to hear you talk about that.
Yeah, I mean, the idea that we have millions and millions of people that are declaring bankruptcy or going on payment plans for bills that they don't have to pay should really frustrate people, right? And I'm in total agreement. I think that, the people that are declaring bankruptcy or going through these big hardships, it is usually because they are lower middle income, right? They're living paycheck to paycheck. They can't afford the hospital bill, which means they wouldn't have to do that if they didn't have the bill. And in most cases, they shouldn't. So I think that the idea that we have people, panicking about these bills, can't pay, declaring bankruptcy, unable to pay rent, their credit's ruined, whatever it is, it really shouldn't be happening. We actually have a system and a law that should prevent this from happening. It's just that hospitals don't tell you about it. They make it extremely difficult to access. And there's no accountability. There's no charity care police. I mean, technically that should be the IRS, but they have not shown a whole lot of interest in enforcing this law that went into effect with the Affordable Care Act. So this has been around for over a decade. And we have hospitals that are reaping all the benefits of this nonprofit status, yet not giving out the community benefit that they should be.
Yeah, I love our conversation prior to having you on the show about how this also has gotten you more into policy. I mean, it seems like hospitals, we all know when you go to your doctor, they care more about your insurance card than you, as that's the first thing they want. And then it seems like if you were successful at this vision of almost shutting your company down, almost the success of the innovation would get that policy on board that all providers are required not only to get your insurance, but just that one little form. And that could be the charity care form or before it, anyway, you go through, help us walk through that. Obviously you're still going to be around, sadly enough. You can't innovate yourself out of business yet, but anyway.
Yeah. I think, we've been pulled into a lot of policy conversations, and because we've submitted over 25,000 financial assistance applications for patients. We've relieved over $75 million in medical debt for people. We know a thing or two about charity care, about this process. We have read every single financial assistance policy that exists. We have a database of every hospital in America, all of their charity care policy data and their eligibility criteria. So we have been pulled into these policy conversations because of that direct service work that we have. We know the patient experience. And I think that is where the real opportunity is, we would like to not exist as a nonprofit. Dollar4 does not want to be the nation's charity care customer service line, right? Like that is just not something that we can do. We would need hundreds and hundreds of patient advocates. But more so, it's the hospitals should be doing this. Like we shouldn't have to exist because this should be on the hospitals to do. And the hospitals have kind of tricked everybody because they have placed all of the burden on the patient. Mm-hmm. You have to find out about these programs. You have to jump through the hoops, fill out the applications, apply, appeal, do all of these things. The responsibility should be on the hospital to identify who is eligible and make it easy. And when I was going through these policies, we would find stuff all the time that's just illegal, Mm-hmm. So I can give a handful of examples, but we'll be getting into the weeds. But there's hospitals that are just not doing this correctly. Mm-hmm. And then if you were to call, I'd say, I don't know, maybe 90% of the hospitals in America and ask them, how do I apply? They're going to mail you a packet, in 7 to 10 business days, and then ask you to fax it or mail it back. So the whole process is terrible, mm-hmm. and inefficient, and they lose paperwork and like all the things. And what the law says in section 501R of the Affordable Care Act, it says, hey, you have to make these policies widely publicized and widely available. And what they have determined that is a poster in the ER room, right? So it's widely publicized, or a fine print on the back of your hospital bill. And then it's on their website. So it's widely available. The problem is people leave the hospital without knowing that it exists. So we are trying to make charity care known, easy, and fair. And we're trying to, in partnership with our direct service work, start influencing policy at the state level to try and convince people that, hey, we need to shift the responsibility to be on the hospital. And there's some pretty easy ways, like you said, they seem to be really good at capturing our insurance information and all of these other things. It would be just as easy for them to capture whether or not someone is eligible for financial assistance. And that's what we're pushing at the policy side.
Could you help our viewers know a little more, understand like the breakdown? You've serviced 25,000, I guess, recipients of your program, $75 million accessed in charity eligibility. What, like, I could imagine like rare disease, some of these pediatric, but where a heart I mean, God could only imagine. What are those things? I mean, obviously, I'm sure cancer is a big one. Could you kind of give texture to those sort of conditions that typically are trends, if you would, that are causing this need for charity care, and the conditions, if you would?
Yeah, you're right. Number one is cancer. Cancer-related hospital bills. So and I would say that our numbers our data is probably a little skewed in a way that is, we've made partnerships with Leukemia Lymphoma Society, American Cancer Society. So they're sending a lot of patients our way. So maybe that unbalances it a little bit, but we do have a lot of people going through cancer treatment that we help. The number two reason is actually childbirth. It is very expensive to have a child. And I think the average bill without insurance is about $24,000. And then with insurance, it's still like $4,000. So we have a lot of people.
And when you mean 4,000, that's out of pocket after the insurance.
Yeah.
Wow.
Yep. And so yeah, childbirth, is a big one. And then you just get all the kind of, heart disease, liver, kidney, whatever type of reasons. Then you just have accidents, people slip and fall, break their leg, whatever. So it kind of break down from there. But number 1 and 2 right now, childbirth and cancer.
So is there, when you look at this, not that I don't want to say providers are egregious, but when you look at our healthcare, not always the outcomes dictate the cost. Obviously, healthcare in America is really challenged, where we're spending so much of our GDP. But is there any other pockets that you feel like treatments are almost, I don't want to say fraudulent, I want to be careful, but where, I hear sometimes there's certain procedures that the efficacy is very, I mean, also we have off-label, pharmacological things that might work, but so I'd be curious to what you've seen with your 25K recipients in there, if there's any other, some aggregate or trends on that.
So I don't think that we would have data on that. I don't think we're asking questions around, so this would be anecdotal, purely, but I mean, and this is just a totally different can of worms. Is like, yeah, we have a huge issue. Like there's no emphasis on preventative care in America, right? There's no, we've got, a big emphasis on like, just take any and all medication, take more meds. I don't know if I could say like, oh, these patients are coming in here with these medical bills that, for surgeries that they didn't need, or, whatever. I can't speak to that, but I do know that I think the latest stats around this were like 85% of hospital bills have billing errors in them. So you are being billed for things that either didn't happen or you're being overcharged for things that did happen. So this is where you get that classic, $75 aspirin or the $50 Band-Aid or whatever. So and we do see that a lot. People come to us with these big inflated bills, and we have kind of recommendations on that. Ask for an itemized bill. Just by asking for an itemized bill, your bill usually comes back at a lower amount, which is just wild. I don't know if that answers your question, but I
Yeah,
don't
no, no, I hear you. And also that's really not, I don't want to say that's not your job, really. I
Yeah.
mean, you're really focused on the people to service, and you're doing an amazing job for your organization. So what would you advocate for people if they're listening, how to be their advocate when it comes to billing? Because it just seems like that as a whole, even when you have insurance, seems so frustrating and annoying.
Yeah, I mean, it's a part-time job. Like, it's a part-time job waiting on hold with all these providers, payers, you name it. It can take a lot of time. I think no matter what, I tell people charity care first. If you get a large hospital bill, you want to see if you're eligible for charity care. And I've kind of been fought on this a little bit because people say, oh no, ask for an itemized bill first. And I'm like, well, why do you care about the accuracy of a bill that you don't have to pay? if you don't have to pay it, who cares?
Mhm.
So you can go to dollar4.org. You can put in your household size, your income, what hospital. It will tell you immediately if you're eligible. Or you can Google your hospital's, financial assistance policy, read through it, see if you're eligible. But that's kind of step number one. Step number two is if you're not eligible, let's say you make too much money, or the bill is too old or whatever, then I would go into, ask for an itemized bill. See if there are billing errors. Like there are websites, I think Healthcare Blue Book, there's a few where you can get on and put in different CPT codes, which you'll see in the itemized bill. And you can see, if you were overcharged or what the average rate for that thing is in your area. And you can do it, a little investigative work. And then always these numbers on the bills are kind of fake. You can negotiate. You can negotiate. I made a video just a little bit ago on Instagram where I just recorded I was negotiating my own medical bill. So I said, okay, hey, this is what, I run this organization. This is what I do with my own bills. And I recorded the conversation, and it was a $1,200 bill, and I paid $300. So you can negotiate. You can ask for a settlement amount. What is the settlement amount? You can ask for, obviously you can go the payment plan route. But if you have a little bit of money, you can usually close that account for 50% off the bill. Now, you have to have the cash on hand. Like, I can't negotiate $1,000 bill to $500 and then say, okay, put me on a payment plan. I've got to close that account out right then and there. But a lot of people don't know that you can do that. So those would kind of be my 1, 2, and 3.
And then what about the qualifications? Say if there's, joint filing, people are married versus one has more income, the other. How about that? Is there any guidance on that when you're filing? Can you file on behalf of someone as the recipient when you sign into a hospital? Is there a thing that you can guide? Because it seems like right there on the spot when you're signing up, my gosh, they want to know everything about you. And still they, so any guidance on before you actually have a procedure to give yourself any more legal standing?
In regards to charity care, I think so that's going to be on the hospital's procedure. Like, some hospitals have something called a presumptive eligibility screening, where they will essentially look at your credit. They'll look at if you're on any other state-funded programs, food stamps or rent assistance or whatever. And if you are on any of those other programs, it automatically makes you eligible for charity care. But some hospitals don't do that. So you can always ask your hospital, hey, I need to apply for financial assistance. But like I said, that process is going to not be great, which is why we do it. You can always go to $4. So yeah, we're definitely, that's another thing, is like, in our policy work, our vision is that if you are eligible for charity care, you don't even get a bill. And that is what we should be pushing for, because if you're eligible for charity care, the hospital should know that by the time, before you leave the hospital. And if they do, then they can apply the discount to your bill.
So really your vision to get this right is to just get so many people aware of your Instagram feed, where it's becoming awareness. Like, man, I know this, Jared, this visionary, $4, it's almost like he's my advocate, he's my representative, and this is the way I fill out the form and get this right before. Obviously, if you have an emergency, you're having a heart attack, obviously, you're going to have to, or you're going in on a stretcher, you don't know where you are or who you are, but it's really being empowered, almost as if you're, a pre-sign up before you have a procedure. That's your vision, I would imagine.
Yeah, I think that's the vision in the short term is, that everybody knows about this, get the word out, raise awareness of the problem. I think long term, though, I would want, in the state of Oregon, we got a law passed that requires hospitals or it prohibits hospitals from sending you to collections or suing you before screening you for charity care. Mm-hmm. So that's great. We want more of that, because now a hospital, can't send you to collections or whatever before screening you, and $4 shouldn't even have to get involved. We're hoping to see our numbers in Oregon go down drastically once this law is implemented. We would like to see more of that. We would like to see more presumptive eligibility screening, which is what I talked about earlier. And then better traditional financial assistance programs. So digital applications, honestly, just copy what we do. It's much, much better than what the hospitals are doing. And then after that, better debt collection practice. Don't garnish people's wages. Don't, all of that.
Mm-hmm. That would be amazing. Like if you end up having another revenue service for a nonprofit for helping the hospitals get it right, and making them almost streamlined, where they just click on your whatever and you can be sustaining in that capacity. Maybe there's going to be some forward healthcare organizations that get it. It's not good PR to do it, what's happening. That would be cool, wouldn't it?
Yeah, I think last year we spent a majority of last year trying to work with hospitals. So what I didn't share in kind of our origin story is in 2021. So I find out about charity care and I realized, oh my gosh, this is crazy. In a few months, I got over $1 million of medical debt to disappear for people in the Portland metro area where I grew up. And so I realized it was this big opportunity. And I'm trying to get the word out. I was not having a whole lot of luck. And then at the beginning of 2021, I posted a TikTok video that told people what charity care was. And it just exploded. It gets 30 million views. It just went all over the internet. And $4 was just me. So from 2021 to now, we've built our team and we've, built out the tech and all of that. It's been a wild ride. But because we had this big social media audience through TikTok and Instagram and Twitter, we had a lot of run-ins with hospitals. So if we couldn't get a application approved that we felt like the hospital was, wronging the patient, we would call them out. We would get on Instagram. I'd say, hey, tag this hospital. So we had a few feisty interactions with hospitals. And last year I said, okay, let's back off that. Mm-hmm. Let's see if we can work with hospitals. Let's see if we approach hospitals and say, hey, we have all this data. We can show you how many patients are reaching out to us to access your charity care application, right? Why don't we just make this easier? Mm-hmm. We couldn't get a single hospital to take us up on that offer. Mm-hmm. So I think that there's a handful of reasons for that. I don't think every hospital is evil and just trying to, bankrupt every patient. I just think that in the world of revenue cycle at a major hospital, the priority is not going to be to make their charity care perfect, right? Or better. Like they are still trying to earn revenue elsewhere. And I understand that. But so, we kind of ditched that program. We're not doing that anymore. And we are trying to go more in the policy direction, because I agree. I think that in the future, hospitals should be working with an organization like $4 or somebody that can come in and kind of audit their system and say, hey, stop requiring patients to fax their applications. That's a terrible idea, right? So it's definitely needed. I don't know if it'll happen in the next year, but it's definitely needed.
So what is the case with for-profit hospitals? What's the percentage? What's the breakdown in America?
So 65% of hospitals in America are nonprofit. And we have about 8,000 hospitals in our database, but that is for-profit and nonprofit. So I believe that we have every hospital in the country, and for-profit hospitals actually still have financial assistance policies. Most of them do. There's just not a federal law saying that they have to have it. So sometimes it can be a little harder to apply. Sometimes it can be a little less generous, but they still have them. So HCA hospital system, I think, biggest system in America. We get medical bills waived there all the time. And that's a big for-profit system.
Cool. So it's good to know that 65% is not for profit. So that's the majority, but still you're providing this service to those who actually, if they're at a for-profit. What else do you think would be really important as we're having this conversation, Jared, that you'd like to share with your work?
I always say, there's a couple things I always say. One, if you have hospital bills, see if you're eligible. Go to our website, go to $4.org. We're going to ask you your household size, your income, what hospital. It will tell you if you're eligible, and then we can take it from there, help you fill out the application. It's all digital. You can do it on your phone, and it's all completely free, no strings attached. We're a nonprofit funded through donors. It is all free. Number two is there's no shame in medical debt. I feel like just the word debt is, this dirty word that people are there's a lot of shame associated with it. And medical debt has nothing to do with your financial responsibility or anything. It has everything to do with a bad system. So don't disqualify yourself. A lot of people look at these programs and say, oh, that's not for me, or they're embarrassed or whatever. There's absolutely no shame in that. So those are kind of my two things, just advocating, hey, see if you're eligible. We might be able to help and spread the word.
Well, I really appreciate you coming on. I think what you're doing is so instrumental. It's unfortunate that you have to exist. Even more important, why you exist. So you are truly a visionary for using the tools, social media, and just leveraging the power of an individual, taking activism, social activism, and doing good with it. What would you say is like your vision over these? I mean, if it was I don't want to go 100 years out, because that would be like after your life, unless we extend longevity. But over your life, your impact with your work, where do you see this evolving? Give us a little bit of your big aha moments.
Yeah, I'm an optimist. I don't feel like I feel like we can solve this problem. Now, do I think that we can solve healthcare in America in general? Maybe not in my lifetime. I don't know. That I'm more of a pessimist on that. But when it comes to charity care, one thing that I'll add here is a lot of times people hear charity care or financial assistance and they just assume it's for the poorest of the poor, right? You can make up to like $120,000 a year as a family of four and still be eligible for a good discount. A lot of these policies will give you discounts up to 400% of the federal poverty guidelines. So you can be making decent money and still be eligible. So the idea that people in that range of income are losing their homes or declaring bankruptcy or all of this is crazy. And I think that we can change that. I think that we can change that in the next 5 to 10 years. I think that medical debt is a bipartisan issue. Most people believe that you should not lose everything because you get sick. A lot of times, healthcare can be divisive, and people might not agree on the solutions, but almost everyone believes that charity care should be a thing, and that you shouldn't lose everything because you get sick. So I think if we are moving into the states, I think we might have trouble in the next 4 years trying to get anything to move federally, but I think that the states are motivated, and I think that we can actually build out laws that protect patients and make sure that charity care is known, easy, and fair, and that it's applied to people that are eligible without having them jump through a million hoops. So I hope to not have to, I can move on to another issue or do something else in the next 5 to 10 years.
Well, I love what you're doing. I would be curious. I know you're not an expert on this. We kind of bridged this topic earlier before this show, but like on the pharma cost and then actual health insurance. I'd love to get your thoughts on that, because it seems like all I want is a catastrophic insurance plan that doesn't exist if you're 30 years older. It just seems like the insurance industry is so powerful. I know your focus right now is not for the not-for-profit with charity care, because they're going to be crying, oh, it's the insurance, we got to do it because the insurance, right? But tell me your thoughts on pharma, the cost of some of these medications. Your thoughts on that, and then also, do you ever see that one day we might have a better insurance cost in general? It seems like that's a big problem too.
Yeah, I mean, again, this is way outside of my expertise. I think that when you have a profit-driven healthcare system, you're going to have a bunch of players that are gouging everyone, right? And right now, it's like you said, it's like that Spider-Man meme, like everybody's pointing the finger at each other, where it's pharmaceutical, insurance companies, and hospitals, and they're all going to blame each other. And the reality is they're all screwing you. So that is what it is. So when you've built a system that is made to profit off of people getting sick, you gotta fix the system. You gotta bring down the system. And so I'm very I don't know how you fix it without, breaking the whole thing. Yeah. So I don't know. It's probably not a great answer, but
yeah. No, I appreciate it. I do hope. I always tell people, I know I share with you, it seems like the most expensive, precious resource here in America next to education, it is healthcare, and it shouldn't be. I would think, one day there was electricity. If it wasn't for these amazing disruptors that said, electricity should be accessible and affordable to everyone, and not just to the wealthiest of the wealthy. And I feel like healthcare should be the same thing, but obviously we do not have a free market. We have a highly regulated, and it's really a huge tax of our infrastructure, our people. And one day, I would like to think in my lifetime that it would be at the right price. Other nations have figured that out, to not make it so expensive. So I guess until next time, I guess that's the way the cookie crumbles or whatever. But let's just go back to you at this last, wrapping it up. Love to just finish off on what you're doing and how people can support your organization. Obviously, you're not for profit. Please share a little more about that.
Yeah, so we're fully funded through philanthropy, through donors. So if you are inspired or you're passionate about this work, you can always give at dollar4.org. And then I would just say, the ways that you can help, the best ways to help is, yes, give to spread the word. People don't know about charity care, about financial assistance. And even just me knowing this, I have helped dozens of family members and friends, and you can be that person. You have people, everybody knows somebody with a big hospital bill that just got a bad diagnosis, that just got in an accident. And this is a resource that can probably help them. So help spread the word.
Cool. Awesome. Well, thank you so much for coming on. I really appreciate Jarrett, and I wish you all the best of success, and may it be 50,000 people you help in the next few years.
Appreciate it. Thank you.
Yeah.